There's no point if we don't have a voice. Our voice is the one that needs to be ministered to.
Here at the Lethbridge Leighton Mackay Rehabilitation Centre in NDG, helping Montrealers with disabilities with support and rehabilitation services, a community of Quebecers living with sensory, motor, and neurodiverse disabilities, as well as different abilities, are sounding the alarm about the new Healthcare Reform Bill 15.
If disabled folks, hard of hearing, deaf, small d, big D, physically, people with mobility issues are not heard, there's no point in any of these bills. There's no point in any reform.
These Quebecers want to address the barriers they experience, getting care, support, and services, and want assurance that they will be included in decision-making and leadership with the changes proposed in the bill.
We need to bring as many diverse people to the table with different levels of ability so that we all have a voice, and people with the disabilities are being muted.
The biggest concern, number one, is inclusivity, in that our needs are not put into all one basket and looked at in a generic sense.
Bill 15, drafted by the CAQ government, contains more than 1,000 articles and would involve the creation of a Crown corporation called Santé Quebec that would oversee all public healthcare system activities.
They haven't really been in consultation, although they say they do, but they haven't been in consultation with the right people. These legislators need to listen to their patients and their users, because bills on paper sometimes look great, but in reality they just don't work. And because this community is so vulnerable, they do not have a voice.
This group says that the Legault government needs to take into consideration several issues concerning people with disabilities, like social services, access to care, education, financial support, employment, transportation, and proper housing. Quebec's health ministry tells City News that the minister has listened to several groups since the bill was tabled, adding that any group has the opportunity to write a brief and submit it to the commission studying the bill.
I just think that we need less bureaucracy, and we need at least 50% more outreach into the community. Bill 15 takes care of the government, in my opinion. There are not enough people or users of services represented, and it's like democracy without representation. It doesn't work.
In Montreal, Gareth Madoc-Jones, City News.